Dr. Richard Schroeder, Naples, Florida 34120. I'm speaking on the fluoride issue. Fluoride is not what you think. Fluoride is derived from fluorine, a highly toxic pale yellow gas. As a member of the halogen family and the most reactive of all of the nonmetal elements, it should be noted that several scientists lost their lives attempting to isolate elemental fluorine. The fluoride itself is not required for any physiologic process in the human body. No one will suffer from a lack of fluoride. The fluoride placed in the drinking water is not even elemental fluoride, but a toxic byproduct of industry. Fluorosilicic acid, which was sold to gullible humanity by clever industry propagandists and has become embedded in our psyches as some kind of a magic fairy dust to prevent tooth decay. Even if this were true, this toxic substance should never have been allowed to be dumped in our public water supply.
Thank you, sir.
Thank you.
Ma'am, go ahead. Guys, sorry. Oh, I'm sorry. Let me just give me a second. I allowed it for the kids because, of course, they're children. The adults, we don't clap in the chamber, and that's on me. I should have said the rules. If you want to recognize or cheer someone on, you kind of do this waving thing that we do here, but no clapping, and please keep it quiet. Go ahead.
Good morning, Brenda Betancourt, 1436 South 6th Street. I'm in favor of A 11A2. This pool, it will be as well helping with the floating, with the lack of lighting in several main streets is my question for the main road, especially in 27, which we're still waiting for those lights to be turned on, the street lights. And 11A3, just a question, how many spaces available will be for new leases, if that is and how would that be able to apply for it, and if that is possible, how can we find out as local businesses to be able to apply for those empty spaces in Miami International Airport? It would be very interesting to find out if that's still available, or we'll have to go through this process of the 11A3 in order for us to see how many there are. Thank you.
Thank you. My name is Richard Mufson. I am born and raised in Miami. I live in Sunny Isles Beach, Florida. I'm a board-certified oral and maxillofacial surgeon who has been practicing for over 30 years. And I could sit up here, and 1 minute is not enough time to really speak to the benefits, the proven health benefits of fluoride at a certain small level on our water supply. I can only say that I was impressed when this commission, as of the meeting a couple of meetings ago, or the last meeting, said we need more information. We cannot decide on this important issue with so little information, only hearing from one side. I have another colleague with me here today, Dr. Johnny Johnson, but other than that, you still will not have information, I hate to say. After a long line of people come up here, and although well-intended, presenting information that still is going to leave you with no information on fluoride, very little information in this short a time frame. My suggestion would be from the heart, if you really wanted to have information on such an important issue like this, please find it within yourselves to have an actual town hall meeting where people can discuss and debate and show literature or ask about studies that are not accurate. You're going to hear a lot of information today that's not accurate. Thank you very much for allowing me to speak.
Thank you. Go ahead. And by the way, the beep is that's your minute. Thank you, sir.
Yeah, Jay Colagan, 34112 for the record. Commissioners, as public servants, your primarily responsibility is to protect the health and safety of your constituents. Yet, by continuing to fluoride the water supply with fluorosilicic acid, you are disregarding both the public consent and growing scientific concerns. It's time to turn the page on fluoridation and align with the other communities in our state that have recently removed this toxin. And if you're waiting for the state to remove this poison, you're missing out on history today. Utah's ruining it from their water. Ohio, Tennessee, North Dakota, and Montana are on board to do the same. These moves reflect growing awareness about the potential risk of fluoridation and the importance of informed consent in medical treatments. So water is to hydrate, not medicate. Back in the 40s, they started doing this nonsense, putting this in the water, this fluoride. That was back at the time when doctors used to prescribe cigarettes to asthma patients. Let's just get these cigarettes away from her. Thank you.
Good morning. My name's Jill Kiley, 1450 Cutler Court, Marco Island, Florida. Thank you, commissioners, for bringing light to the subject of mass medication through fluoridation. I brought with me the MSDS sheets from your water department that I would like to enter into the record so you can see what you're putting into our water. It is not naturally occurring fluoride, but rather the industrial waste byproduct of the phosphate and aluminum industries. Fluorosilicic acid. It is not purified and contains arsenic and lead. The pro-fluoride advocates would like to have you believe that when added to the water, the toxins magically turn into ions that are not harmful. Obviously, this is blatantly untrue. Many citizens in Miami understand that mass medication without informed consent is tyrannical. They want freedom of choice of what they put in their own bodies. Please end supplemental fluoridation of the water and protect your citizens, especially the babies and children who are most susceptible to harm. Thank you.
Good morning. My name is Magdalena, 21 Madeira Avenue, Coral Gables. I think that what I was going to say, many of them have said it before, so why, I don't want to repeat the same thing, but it's very important to know that over 97% of the world has banned this called fluoride. And as she said before, what you're putting on the water is not a pharmaceutical grade fluoride. It's a poison, and this is what we are ingesting. Besides that, I don't think that the county should be medicating people without non-consent. The FDA have said that the fluoride is a drug, and it's right here. You can see it right here. So if you take more than what it's supposed to be brushing your teeth with, then you have to call and go to the hospital or call 911. This is, how bad it is. So thank you.
Good morning, Commissioners. My name is Scott Kiley, Stand for Health Freedom, 1450 Cutler Court, Marco Island, Florida. If you keep fluoride, what will you tell your citizens? How will you inform your most vulnerable? Will you inform your pregnant women of the CDC's admissions under oath? Pregnant women should avoid water fluoridation. Will you warn young mothers? The CDC does not recommend fluoride in the first 6 months of life. Will you suggest, or better yet, provide filters to the most vulnerable citizens to remove the toxin that you are adding to the water? You cannot stay silent and pretend to be unaware of the latest data. Do you see the trick bag you are in if you continue to force a medication without informed consent? Commissioners, respectfully, you're not doctors. It is impossible to give adequate informed consent to your citizens. Exercise the precautionary principle and please end water fluoridation today. Thank you.
Thank you. Lissette.
Hello, Lissette Monson, 13455 Southwest 68th Terrace. Happy to be here to speak on behalf of 11A10 for the removal of fluoride from our public water. Rather than focus on the pros and cons of fluoride, I'd like to focus on the underlying issue, which is medical freedom. Some families choose Crest with fluoride to keep their teeth healthy. Others choose hydroxyapatite to naturally mineralize the enamel. Some go to a holistic dentist. Others choose conventional. That is not the focus. The focus is that when each of those families goes to the zoo and wants to fill up their public drinking water with public drinking water, one is getting involuntarily exposed to a chemical they would otherwise avoid. This unsolicited exposure is comparable to, and I just have to mention, a family that turned their Wi-Fi off at night, and then all of a sudden a 5G tower pops up next to their window, involuntarily radiating them 24 hours a day. It makes no sense. This resolution gives me hope. Please make the right choice towards removing uninvited toxins. Thank you.
Good morning. My name's Terry Convey. I'm with District 7 in Coral Gables. And first, I would like to thank Commissioner Gonzalez and the board and the mayor for, bringing forward this resolution and your consideration and possibly your favorable vote for removing fluoride from the drinking water and our water supply in Miami-Dade County. I wanted to be here today. This is the first time I've spoken at an event like this, just because I think it is a courageous and bold action to review what we've done for decades in light of new information and the need to further evaluate and study the health and risk benefits of putting fluoride in the drinking water. I've heard from the colleagues and have been made aware and believe that there are plenty of affordable and reasonable options for protecting the tooth decay of children, and that we don't have to do it with this wholesale, broad brush, changing our drinking water with a toxicant that is actually an industrial byproduct.
Thank you.
Good morning, Commissioners. My name is Josh Jemmy. Do I have to get my address? Or okay, 16750 Northeast 10th Avenue, Miami. So today, as we begin Autism Awareness Month, we're reminded to protect our most vulnerable, our children. For decades, Miami-Dade has added fluoride to our water, assuming it's harmless. Yet emerging science links fluoride exposure to neurodevelopmental risks, including lower IQ and behavioral challenges, issues that echo concerns in autism research. Fluoride's benefits are topical, from toothpaste, not ingestion, and today we all have that choice. Adding it to our water forces an unnecessary chemical on everyone, pregnant women, infants, and families without consent. Governor DeSantis and Dr. Ladapo call this practice outdated. Let's honor Autism Awareness Month by prioritizing caution and freedom. I urge you to support Commissioner Gonzalez's legislation to remove fluoride from our water. Let's safeguard our kids' futures. Thank you.
Good morning. My name is Dr. Johnny Johnson. I'm a pediatric dentist. Address 222 West Park Avenue, Chiefland, Florida. I rise in support of water fluoridation. I lead the American Fluoridation Society, like the British Fluoridation Society and Canadian Fluoridation Society. We're nonprofits. We take no salary for what we do, but we provide evidence-based science to communities so that they can make decisions based on the best available evidence. I will say to you that what the Safety and Health Committee heard from Drs. Ladapo and Dr. Mowlin was absolutely one-sided. We have done a presentation opposite them in Bartow, Florida, very nice to watch, where the community saw what was going on. There's literature that's not being presented to you. I sent you a 24-page packet. There are strong studies that totally go against what they're saying. There is no credible evidence that there are neurotoxic effects from fluoridated water. No country is stopping it. Please keep fluoridation in your water. Thank you very, very much. Have a workshop, please.
Good morning. My name is Erwin Sainville. I am born and raised in Miami, Florida. I am a board-certified pediatric dentist, Haitian American. And on behalf of the Florida Academy of Pediatric Dentistry and American Academy of Pediatric Dentistry, we do support fluoridated water. We're just asking that it remains at an optimal level so it does not cause the effects that you have seen. Also, the studies that have been done have not been based in the United States. Even Canada, when they decided to remove fluoride from the water, they did see an increase in dental decay. As a pediatric dentist that services Medicaid population and the underserved, we have an increase of children who are being very affected from tooth decay. And with us removing fluoridated water without keeping it optimal level, then we are going to see a rise. I have patients that are in hospitals that are hospitalized because of dental infection. They're missing out on school. Their parents are missing out from work. So please, we support the fluoridated water. Thank you.
Good morning, Commissioners. My name is Martha Bueno. Address is 11455 Southwest 40th Street, and I want to thank you very much for having this discussion here today. It costs $0 to take the fluoride out of the water. Meanwhile, the filters, in order to not have the fluoride in your water, cost thousands of dollars. You are harming those who cannot afford to pay to have clean water. It is our right to not be intoxicated by our government. I urge you to please vote in line with the citizens of Miami-Dade County, keeping in mind that the fluoridation was added to our water in 1958. Nobody on this commission voted in favor of it, and nobody in the public voted in favor of this. It is easier to simply not add it than to continue to cost the residents of Miami-Dade so much in terms of their health. Thank you so much. I appreciate you.
Thank you. All right, I have Maya Asi, Maria Alexandra Garcia, Susie de Jesus, Heather Berman, and John Lewis. You may approach and continue the same pattern. Everybody's been doing really good. State your name and address, and you have a minute to speak.
My name is Dr. Maya Georges Asi, 6877 Northwest 107th Terrace, Parkland, Florida. I'm here to speak on fluoride. Just last week, I saw a patient in my chair, a young patient with dental fluorosis. Dental fluorosis happens when there's an overexposure to fluoride, which causes a disruption in the normal development of a tooth. This was widespread. Every single tooth had it. The enamel looks pitted, chalky, white, and on this particular patient, second molar came in with an entire piece of the structure just missing. It's hard for me to understand how other dentists can look at dental fluorosis, which has been deemed only a cosmetic issue, and think that during the first 9 years of the development that this did not disrupt other systems in the body. What happened to the skeleton? What happened to the thyroid? What happened to the brain? What happened to the kidneys? I thank you so much for considering this, and I ask you to please vote to remove it from our water. Thank you for your time.
Thank you, doctor.
Hello, my name is Susie de Jesus, and my address is 8403 Pines Boulevard, Pembroke Pines, Florida 33024. Basically, clean water starts with the removal of fluoride. In 1983, John Y. found that fluoride ions disrupts hydrogen bonds. They can also disrupt enzymes, DNA, and wreck molecules, lead to genetic damage that will be passed on future generations. Fluoride hazards are dental fluorosis, sterility, birth defects, cancer, and brain damage. Panacea or poison. As a medical journalist in London, Anne Lees, in 1945, dedicated decades of research. She created the concept that was called dental mafia, and they were naive, and this was back in 1945. And fluoridation was pushed by mind control plot by the Rockefellers back in the 1940s. Rockefeller paid Erwin Syndicate astronomical salary at the ALCOA. In 1992, Mr. Mullen wrote a dumbing us down. Please remove fluoride. Here it shows you how hydrogen ions are damaged in your body.
Hi, my name is Heather Berman. I live at 307 Northwest 1st Avenue, Fort Lauderdale. I was injured in 2017 from the tetanus vaccine. It's a neuro injury, and I'm half numb from the waist down. Fluoride is a neurotoxin that is in the water that I cannot avoid. So every day I'm getting a neurotoxin on me and in me. The children who have autism, who were injured from vaccines, are getting a neurotoxin put on them in their water every day. All of you should be looking at every single one of us, listening to us, and knowing that your service is to take care of the citizens. You went into service to listen to the community, and I don't even see many of you listening. We're telling you that we want clean water, clean food, and clean air. Take the neurotoxin out. You do not have the right to medicate us.
Thank you, ma'am. Sir?
Good morning. Dr. John Lewis from 6792 Southwest 69th Avenue. I would like to encourage the commissioners, thank you for taking the time, by the way, to please look at the most recent federal court judgment ruling that the EPA basically has not been doing its job. It's ruled now that there is reasonable risk, especially to children, that fluoride is a neurotoxin. So please look at this case if you're not familiar with it. I would really encourage you to do that. In addition, if you look at the data, at least for the last 50 years, if you look at the epidemiological data of countries that fluoridate their water versus those that do not, the level of cavities is non-significantly different. So there's really no good reason for us to continue medicating ourselves with this neurotoxin. I would highly encourage you guys to please get the fluoride out of our water. It is a health freedom choice and issue. Thank you so much.
Thank you, sir. Ma'am?
Good morning, Commissioners. My name is Maria Alexandra Garcia, 11455 Southwest 40th Street. And I stand here before you not just as a concerned citizen, but as someone who has personally felt the devastating impacts of fluoride in our water. I have Hashimoto's thyroiditis, an autoimmune disease, and after years of struggling with symptoms, one of the most significant changes that helped me improve was removing fluoride from my water. What many people don't realize is that fluoride was once prescribed as a treatment to suppress thyroid function in patients with hypothyroidism, not what I have. It was used because fluoride disrupted the thyroid's ability to produce hormones, and yet today that same fluoride is being added to my drinking water, without considering those of us who need to protect our thyroid function, not suppress it. For those of us with thyroid disease, every sip of fluoridated water is like taking a small dose of medication we never asked for. And unlike actual prescription, we have no choice in the matter. The only way to avoid it is to invest in expensive filtration systems that not every family can afford. Fluoride is not the only issue in our water, but it's a good place to start. It's time to stop forcing a mass medication program in our public.
Thank you.
Thank you.
Thank you so much. All right, that's all the public speakers I have signed up to speak under reasonable opportunity. So with that, I hereby close reasonable opportunity. Reasonable opportunity is closed. And I want to recognize the Florida Surgeon General who is with us here today. Thank you for being with us. Will you be able to stick around, or do you have to catch a flight or head back?
Dr. Mallon and I are here, and we actually just wanted to briefly talk, similar to other individuals, but...
So here's what I'm asking. We're going to take this item up a little bit later in the meeting, and at that point, you can be recognized, because I have a time certain meeting that I have to start with the city of Hialeah, the council's here. So if you have to go, I'd recognize you now, give you that courtesy, obviously, but if you're going to stick around, I'd rather do it when we get back.
No one's ever rushing to leave Miami.
All right, that's fair. That's a great point. With that, I have, unfortunately, to ask you, Surgeon General, if you could please give the front rows to the city council, and then you could resume once our meeting is over. That's a hard ask of you, but appreciate you. And then if the city council and staff may approach the first